My name is Hannah Blades, and I'll be presenting our service review looking at patient outcomes over the past 5 years after we implemented a perioperative frailty MDT for selected patients scheduled for urological surgery at Whit's Cross Hospital. It's widely accepted that frailty results in increased rates of postoperative complications, including geriatric syndromes such as delirium and increased mortality rates. Despite this, recent data from the Royal College of Anaesthetists shows nearly three-quarters of UK hospitals are not routinely screening patients aged 60 or over for frailty. Our perioperative frailty MDT, made up of consultant anaesthetist, geriatrician, and urologist, was established in May 2021. Referral criteria into the perioperative frailty MDT includes patients aged more than 65 with a clinical frailty score of 3 or more. The referral could come from either preoperative assessment or the surgeon upon booking the case. Patients were then virtually reviewed by team members before being discussed at a monthly meeting. Documentation of this discussion was recorded in the patient notes, which we have retrospectively reviewed for a 5-year period from May 2021 until April 2026. The primary aim of the project was to establish the impact the MDT had on patients' surgical journeys. Secondary aims were to establish operating outcomes and complication rates. 5 main outcomes were identified from MDT documentation. Patient to proceed with scheduled procedure. Patient required optimization before proceeding. Patient would best suit an alternative procedure, for example, a less invasive flexible cystoscopy under local. Requires discussion for shared decision-making with the patient as identified as high risk, or they were cancelled as unsuitable for procedure or anesthesia. Over the 5 years, a total of 237 patients were discussed with an average age of 82 years old and an average clinical frailty score of 5.4. The graph illustrates the primary aim of the project, showing documented outcomes from the MDT, with 63% of patients benefiting from MDT involvement during the elective surgical pathway. Where the MDT advised further patient discussions were needed for shared decision-making, 45% of patients opted out of undergoing the recommended surgical procedure, highlighting the importance of patient involvement, education, and empowerment around their own care. For our secondary aims, we assessed the outcomes of high-risk patients who proceeded to surgery. Only 18.6% of these patients had a complication which delayed discharge, significantly lower than the 30% found in 2019 prior to the MDT being established. Only 3 patients in the 5-year period suffered a hospital-acquired geriatric syndrome, and only 5 cases were cancelled on the day. The 30-day mortality for the 5-year period was just 3 patients, compared with 7 in 2019 alone. Overall, the perioperative frailty MDT has been key in identifying high-risk patients who benefit from shared decision-making and optimization prior to undergoing proposed surgical procedures. It allowed us at Whit's Cross Hospital to proceed with the right surgery for the right patient at the right time. Thank you.